Assalamualaikum. Let's talk about radial nerve lesion. If the radial nerve lesion is very high, like very high lesion, that means in the axilla, then the motor symptom would be unable to extend elbow, wrist, and fingers. So if there is lesion, very high lesion or lesion in the axilla, can happen due to dislocation of the shoulder joint, can happen due to crutch injury, can happen due to fracture of the proximal humerus. Then the motor symptoms is unable to extend elbow, wrist, and fingers. And sensory loss is loss of sensation down the posterior surface of the lower part of the arm, loss of sensation over the posterior surface of the lower part of the arm, a narrow strip back of the forearm, lateral 2/3 of the dorsum of the hand, and lateral 1/3 finger of the dorsum except half of distal phalanx. If it is high lesion or lesion in the radial groove or spiral groove happens due to fracture shaft of the humerus, or can happen in supracondylar fracture, can happen in elbow fracture. The motor symptoms is unable to extend the wrist and the finger, and sensory loss is lateral 2/3 of the dorsum of the hand, lateral 1/3 of the dorsum except half of the distal phalanx. And if lesion is at the elbow or low lesion, it can happen in forearm fracture or Monteggia fracture. In here there is only finger drop, so in here wrist drop does not occur as extensor carpi radialis longus is not affected and maintains some extension of the wrist, only wrist finger drop and sensory loss lateral 2/3 of the dorsum of the hand and dorsum of the lateral 3/2 of the fingers except the distal half of the phalange.